Begin by placing the foot on the ball. Slowly roll back and forth through the tissue. When you identify a tender spot, stop and stay on it. Hold this position for 20 to 30 seconds or until 75% of the pain diminishes. Make sure that you roll through all parts of the foot, taking time to stop at the balls of the feet and the heel. To get the lateral band of tissue that runs along the outside edge of your foot, I really love to use the footballer. Slowly roll back and forth. Again, when you find a tender spot, stop and stay on it, taking time to roll through each part of the tissue very, very slowly. Another tool that I like to use is the foot wheel. This is made by the makers of the stick. One thing I really like to do is to be able to sit at my desk with this. It's a great tool for clients to use at home when they're watching TV or when they're seated at their desk. Because of the points on the foot wheel, not as much pressure is required to elicit the same type of response that we see when we use a ball or the footballer. Another way to get at the plantar fascia on the bottom of the foot is to use the travel roller red ball. This ball is the most firm. They also make a yellow ball and an orange ball of lighter intensities or lighter densities. I prefer the red ball as I can control the amount of pressure on the foot. As the ball heats up, the ball will kind of deform to different shapes in the foot. Begin by rolling out the soleus using the grid made by Trigger Point Therapy. Slowly roll back and forth, kneading through the tissue, rolling through a small area at a time. When you feel like you've sufficiently gotten through the tissue, move on to a different spot. To increase intensity, place your leg on top of the other leg. For greater intensity, I like to use the quad baller on the soleus. Again, take note that you roll in line with the orientation of the tissue. If the tissue is running from top to bottom, you want to stay in that line. In addition, also add in some internal and external rotation of the leg. That'll allow some cross-frictional force through the tissue. Once I've identified a specific area within the soleus, I like to use the Trigger Point Therapy ball to pinpoint that with laser point accuracy. Once you have the leg on top of the ball, gently move the foot back and forth into plantar flexion, dorsiflexion, add in some rotation, some inversion, some eversion to further expose that tissue and open it up. The following video clip depicts another great way to get at the soleus using the Trigger Point Therapy ball. Begin by placing the ball on the medial portion of the soleus, using the contralateral hand first, followed by the opposite hand. Apply pressure, gently rock the ball back and forth till you find the desired spot. The Trigger Point Therapy block and foot roller also provides another wonderful way that we can get at the soleus. When using this equipment and this technique, it's very important to not only slowly move through the tissue, but also to make sure that you add some internal and external rotation of the tibia, while at the same time moving the foot into plantar flexion, dorsiflexion, and rotation, so that you're moving that tissue around and opening it up so that we can expose as many of those adhesions as possible. We can also get at the soleus using the stick, slowly roll back and forth just like we would with a roller or any other piece of myofascial training device. Again, when you find a tender spot, you want to stop and stay on it, hold that spot for 20 to 30 seconds or until 75% of the pain diminishes. When rolling out the gastrocnemius, take time to take the leg into internal and external rotation so that you make sure to get the medial head of the gastroc and the lateral head as well. When rolling through, take your time. Think about kneading through the dough, kneading through the muscle tissue, trying to expose as many of those adhesions as possible. When using the trigger point therapy quad baller on the gastrocnemius, take time to roll back and forth nice and slow, making sure to pause on any tender spots. Remember to hold each tender spot for 20 to 30 seconds or until 75% of the pain diminishes. You can also internally and externally rotate the leg to expose different areas of the tissue. Another great technique to get at the gastrocnemius is to use a product called the stick. Slowly roll back and forth with the stick, taking time to pause on areas that are tender. Slowly roll back and forth on the perineals. To increase the intensity, place both legs on top of each other. Make sure to take time to move back and forth slowly, pausing on any tissue that is tender. Hold that position for 20 to 30 seconds or until 75% of the pain diminishes. We can also turn on our side as if we were doing our IT band to work the perineals. Note, many of these exercises are also beneficial at strengthening the core. One area that's traditionally overlooked when performing self-myofascial release is the tibialis anterior. It's very important to properly hydrate this tissue, as if it is not hydrated properly, it will very easily become dysfunctional. Slowly roll back and forth. To increase intensity, lift the opposite leg. Another great way to get at the tibialis anterior is to use a product called the stick. Slowly roll back and forth along the tissue, taking time to pause at any areas where you have a tender spot. When dealing with foot, ankle, knee, and hip issues, I often find that the popliteus is a muscle that has very intense trigger points. Begin in this seated position with one leg extended. The leg that's extended has a ball just below the knee. You're looking for the space that's at the top of the gastrocnemius. Find the trigger point just behind the kneecap on the back side of the knee. This is your popliteus. When rolling out the hamstrings using the grid, make sure that the leg that's extended, that you're using the same side arm behind you, just behind your hip, to balance. Do your best to keep your chest and shoulders over the point of contact with the roller so that you're keeping the most pressure on the roller as possible. I find that most individuals are going to find tender points near their ischial tuberosity, where their hamstrings connect into their pelvis, or out towards the lateral portion of the knee where the bicep femoris connects. When rolling out the adductors, begin in a prone position, frog the leg up to 90 degrees as the video depicts, then apply pressure with the opposite foot, in this case my left foot, so that my left hip comes up. Note how my left forearm is down on the ground, much like a side plank or even a prone plank. This allows me to put pressure onto the inside of my right thigh. I can also create some shearing forces by extending my arms and changing my leverage point so that I have a force that slides back on the roller. When rolling out the quadriceps, choose a side, beginning at the top of the thigh, slowly roll back and forth. Note, you can internally and externally rotate your pelvis so that you get different portions of the thigh. Outer portion of the thigh, inner portion of the thigh. We can also bend the knee to 90 degrees. This is going to lengthen the tissue through the quadriceps, specifically the rectus femoris. And then while the knee is bent, we can also internally and externally rotate the leg to add in a level of increased difficulty. Take note that you don't arch the back too much. Keep the glutes nice and tight so that your low back is supported. To increase intensity, lift the opposite leg so that there are less points of contact with the ground, thus putting more force into the roller. The TFL is a very small area at the top of the thigh. With all of the other exercises, we've spent time depicting and discussing on how to roll through these tissues. When you're performing exercises on the TFL, it's best to rock instead of roll. So we'll find the TFL, we'll add in a little internal and external rotation. It can also be beneficial to bend the knee to 90 degrees and then add in the internal and external rotation, thus increasing the amount of trigger points that you can find in the TFL. When rolling out the IT band, assume a side plank position. Do your best to keep the spine in a nice neutral position. If you're looking at the video now, my head could drop down a few inches to keep more of a neutral spine. In addition, we can also use the top leg forward, top leg behind, or top leg on top. This will increase the intensity when both legs are on top of each other, but I can also take the leg to the front or the back depending on if I'm trying to create some internal or external rotation through the pelvis to expose different areas of the IT band. From the prone position, you'll place the ball approximately 2 inches to the side of the belly button. Note that the ball can be moved more medially or more laterally, but a good starting position is approximately 2 inches from the belly button. From this point, you'll pick yourself up and move yourself so that the ball moves down towards the thigh so that you get the greatest majority of the iliopsoas. Lift the leg on the side that the ball is located to increase intensity. You can also push down into the ground with your arms, lifting your head and chest to further increase this intensity. Place the roller just below the waistband on the side that you're rolling out. Take note that the leg that's extended, that same side arm is behind. This will give you proper support throughout the exercise. Roll slowly back and forth through the tissue. Note that you can also move more internally or externally on the femur so that you're getting the lateral portion of the glute or the medial portion of the glute. A softball or baseball can also serve as another great myofascial release tool to work on the glutes. When I want to focus specifically on the gluteus medius, I like to use the trigger point therapy ball. Note, moving the leg, bending at the knee, bringing the thigh towards the chest, internally and externally rotating the leg allows me to get at different fibers of the glute med. When rolling out the piriformis on the grid, it's going to begin just like when you're doing the glutes, except you're going to cross your leg. When you cross your leg, you're going to find many of the same tender spots in the same areas that you found them when doing the glutes, but now they'll often be more intense. To pinpoint the piriformis, I like to use the trigger point therapy ball. This allows me to focus specifically on the piriformis. I can do this with my legs straight, or I can do it with my leg crossed. The grid works very well to get at the erector spinae. Begin by placing the grid in the low back. Slowly lean back, walking your hips away from the grid. Begin with the grid at the top of the shoulders. Note how I'm holding my ears gently with my fingertips. This will allow me to move my elbows in and out. This allows for different positioning of the scapula so that different tissues can be exposed. Slowly roll down towards the low back. As you get into the mid part of the back, you can take your hands off of your ears, putting them over your chest or abdomen to help offset your center of gravity. When you get into the low back, if it's too difficult to hold that position, feel free to have the client lay down, putting their head and shoulders on the ground. Rolling side to side allows us to get at the quadratus lumborum. To sit up, extend your legs, act as if performing a hamstring curl. Oftentimes you're going to find that your clients have trigger points in their lumbar erector spinae, right around the top of their pelvis, near their sacrum. Using the trigger point therapy ball, focusing on one side or one specific spot or area at a time, really helps us to key in on those tender areas. By lifting the leg, we can increase the intensity, move the leg in and out, left to right, internally and externally rotate that femur. The grid provides an excellent way at getting at the latissimus dorsi to reduce myofascial adhesions. Begin in a side lying position, trying to keep the spine as neutral as possible and as much in a straight line from fingertips to heel. Feel free to lean in or towards the ground with your chest or away from the ground, exposing different areas of tissue on the roller. For clients that have shoulder issues or problems, if it's uncomfortable for them to have their arm directly overhead, it's okay for them to bring their arm perpendicular to the body. This might be a more favorable position and be much more comfortable for them. To roll out the triceps, assume a side lying position. Once in a side lying position, it's okay to turn more towards a prone position so that your chest is roughly at a 45-degree angle. Roll back and forth from your shoulder to your elbow. Make sure to internally and externally rotate your humerus so that you can get at different parts of the tricep. When rolling out the chest, begin from a quadruped position. Extend one arm to the side, perpendicular to the torso. Lower yourself down and slowly roll back and forth from the medial part of the chest towards the humerus where the tendon attaches. To increase intensity, drop down to your toes so that you have more body weight onto the roller. We can also go more vertically by extending the arm overhead. The trigger point therapy block and ball is another excellent way that we can get at the pectorals. Begin by placing the ball against the chest, take the block, put it against the ball, apply pressure through the block so that the ball pushes into the fibers in the chest. Slowly move the ball back and forth in a gentle rocking manner, or just merely pick up the ball and put it in a new position. When rolling out the biceps, assume a quadruped position, extend one arm so that it's perpendicular to the body. From the shoulder To the elbow, roll back and forth nice and slow. Take note to move the arm internally and externally so that we can get at different positions of the tissue. We can even go past the elbow onto the forearm. Assume a side lying position with the elbow and shoulder each at 90 degrees. Internally and externally rotate the arm to determine your range of motion. Then place the ball on the posterior deltoid and move the arm again back into internal and external rotation, looking for tender spots. You can also supinate and pronate the wrist. Again, move through as full a range of motion as you can. After identifying your trigger points and reducing them, remove the ball and then retest for range of motion, and notice what a great difference you experience. One of my favorite ways to get at the infraspinatus is to use either a theracane or a back buddy. This allows me to, with pinpoint accuracy, get at the infraspinatus and easily control the amount of pressure. In the absence of a theracane or back buddy, you can use a tube sock with a tennis ball inside, leaning against the wall to apply pressure to the infraspinatus. Note that I'm holding the tube sock with the contralateral arm so it does not fall. I move my arm back and forth to expose different areas on the infraspinatus. The back of the neck often contains many tight and tender spots. Begin by lying on the back. For clients that are deconditioned, just have them gently push the back of the head down towards the ground. They can also slowly roll from side to side and then again push at an angle so that they're pushing on one side of the neck. For clients that are more conditioned, they can begin to apply pressure through their feet, lifting their hips into hip extension. This will increase the amount of force and intensity on the back of the neck. Roll side to side, nice and slow, and a gentle rocking motion from top to bottom. Another great myofascial release tool is to use the stick when trying to get the back of the neck. Note that I'm not going to roll squarely on the back of the neck. I'm going to take a bit of a 45 or anywhere between a 30 and 60 degree angle on the back and side of the neck. Oftentimes clients will have tender spots in the occipitals located at the base of the skull. Roll back and forth, nice and slow. Using the ring finger, middle finger, and pointer finger of the contralateral hand, reach up above the clavicle and reach in and press the scalenes. You're looking for a tender spot here located on the first rib. Most likely you'll be able to find the anterior and medial scalenes. Again, find a tender spot and hold until 75% of the pain reduces. Using the ring finger, middle finger, and pointer finger, but applying pressure with the middle finger, look for a spot just below the elbow between the radius and the ulna. Chances are it's going to run approximately 2 inches in length, and dig in gently with that middle finger looking for a trigger point. Feel free to move the wrist into extension and flexion or rotation to expose additional tissue.